We often treat severe conditions like depression, schizophrenia, and childhood ADHD by administering medications that forcefully suppress physical symptoms. We trap the chaos, but we rarely resolve it. But those behavioral and physical symptoms are surface-level alarms. The actual fire is burning in the patient's deep psychological state. If a patient harbors unresolved trauma, profound grief, or chronic anger, a treatment plan that only addresses the physical body results in a clinical dead end. The traditional medical model prioritizes the symptom and ignores the mind. It is a system that fails to account for the internal mechanics of the patient's life. At HomeoCare de Shore, Dr. M.D. Hassanuzzaman has developed a protocol to address this gap. It is called the MIND technique. This integrated homeopathic methodology requires a full psychological analysis before any physical medicine is selected. Identifying the mental driver first allows the clinical team to target the mechanism of the disease rather than just its effects. The first step of the protocol involves extracting the patient's hidden thoughts, suppressed emotions, and past traumas during the initial assessment. This psychological data informs a dual treatment plan, integrated counseling paired with targeted homeopathic remedies. This approach is designed to stabilize patients facing complex conditions, including schizophrenia, severe anxiety, and long-standing relationship conflicts. By treating the psychological root, the clinician creates a feedback loop where the mind and body actively support each other's recovery. In pediatric care, the challenge is greater. Young children lack the vocabulary to explain their trauma or their mental state. Dr. Hassanuzzaman conducted specialized research in London to address how clinicians can decode these unexpressed states. This methodology for treating pediatric cases through the mental state was officially validated and certified. Decoding a child's psychology through this method allows for more precise treatment of ADHD, autism, and severe behavioral stubbornness. Understanding the pediatric mind provides the diagnostic data required to address developmental disorders at their source. The MIND technique adds a final layer to the clinical work, the body's internal chemistry. Using his training in public health and nutrition, Dr. Hassanuzzaman implements strict lifestyle and dietary protocols. The clinic requires patients to adhere to specific sleep hygiene, stress management, and clinical nutrition standards. Correcting these physical factors provides the metabolic stability the brain needs to maintain psychological progress over the long term. The success of the MIND technique in Joshua has turned a local clinical practice into an academic movement. To expand this work, Dr. Hassanuzzaman launched the Public Health Research and MIND Technique Seminar Portal. This digital interface provides medical professionals with access to live international seminars and advanced lecture materials. Doctors can purchase these professional courses to study and apply the MIND technique within their own clinical practices. Standardizing this integrated data allows the protocol to reach a global population of patients through their local practitioners. Health is the harmony of the mind and the body, not just the absence of a symptom. By addressing the psychological depths, patients can stabilize their health in a way that medication alone rarely achieves. Patients can book a telehealth consultation with HomeoCare Joshua today. Practitioners can enroll in specialized courses through the seminar portal. Treating the mind and the body as a single system. This is the integration of mental health and homeopathy.